Hello, my name is Daniel Sirengo.
And I'm Owoche Kate.
We are trained first aiders and we are here to demonstrate to you how to perform a cardiopulmonary resuscitation, also known as the CPR. This is an administration that is done on a person who is unconscious and having difficulties in breathing. My colleague Kate will take you through how to administer the CPR on an adult.
The first thing to do when you get to an incident area is to check for danger. Check if there are any falling objects around your casualty. If the accident occurred along the road, please move your casualty away from the road so that we prevent occurrence of other accidents. So I'll tap my casualty's shoulder to see if she's responsive. If she's not responsive, I will pinch her earlobe to see if she's responding to pain. If she's not responding to pain, then I'm going to tilt my casualty's head and check the airway. So this is how you tilt the head. And then I'll open her mouth and I check if there is any obstruction. So my casualty does not have any obstruction. I will go and check my casualty's breathing, and my casualty is having issues with breathing, so I will go and check her pulse. I will check my casualty's pulse. Her pulse is fine. So, call for help. So,
yeah.
airway iko. Aya, funga, rudisha kichwa vizuri. Alafu angalia breathing, eka kichwa ikiangalia kifua yake. Aha. Toka. Pulse. Aya, toka. Aya, chukua simu uweke hapo. Eka tu hapo mbele. Anza CPR. Kiss 5. Fungua. Enda close. 1, toka. 2, 3, 4, 5. Aya, kifua. Twende. Hii imetosha. Imetosha.
Nice.
Well, it is always important to look at the airwaves, and when you tilt the head, it is important to look at any possible blockage in the mouth. Let's say, for instance, it could be food or even vomit. So once you locate the blockage inside the mouth, you have to pull it using the 2 fingers. So you pull it out in order to clear the airwaves. So literally, the importance of removing the vomit or the food, whatever is blocking the air, whatever is in the mouth, is actually meant to clear the airway so that the casualty can be on a more vantage point of receiving the rescue breath. So normally it is important to look at, to confirm whether the casualty is breathing or is not breathing. And that can only be confirmed by moving so close, you place your cheek near the nose or rather the mouth of the casualty while you observe the movement of the breath of the chest. So you can be able to locate whether the casualty is breathing from a distance when you look at the chest movement, as well as if you feel the moisture in your cheek, it means that the casualty is also breathing. You can confirm circulation by looking at the pulse rate on their hand. Now it is always important you use your two fingers and place them at the wrist joint of the casualty, just to confirm whether blood is circulating throughout the body. Now after doing that, you will be at a more vantage point of now knowing how to handle the casualty. Then it follows that if you have confirmed all the previous procedures, then you need to now do the press on the infant. So you use the two fingers and you press them at the sternum of the casualty. And you have to press it at least 30 times at a speed that translates to at least 100 compressions per minute. It's always important to do that. 100 compressions per minute. So basically when you do that, while you're doing that, you're also giving a call to the most immediate rescue team who can come in for more reinforced help so as to help save the life of the casualty. So you have to repeat the cycle for as long as it takes until help arrives. After assessing the state of the casualty, it's always important to advance to the administering of the rescue breath. It's always important. That breath goes throughout into the breathing system of the casualty, and it therefore tries to reverberate and it gives some more life to the lungs, and therefore you can be at a more vantage point of rescuing the life of the casualty. So it's always important. The rescue breath is always important, and do that at least 5 times for an infant, and it alternates from the rescue breath to the compressions.
Next thing to do is to check if your casualty is breathing and if the breathing is normal. So you will have to come closer to your casualty and tilt your head, face your casualty's chest. Be vigilant, check if your casualty is moving, your casualty's chest is moving, and also feel if there is moisture coming from your casualty's nose to show that the casualty is breathing. The next thing to do is to check your casualty's pulse, and most of the times we're supposed to use our 2 fingers, these 2 fingers. So I will take my 2 fingers and place them on my casualty's wrist and feel the pulse. If you realize that your casualty is unconscious and is not breathing normally, then the first thing you should do is to call for help. If you have someone around, please ask that person to call an ambulance. And if you're by yourself, please make a call to the nearest hospital or any ambulance that can come and pick the casualty. And make sure you're making the call on loudspeaker so that you can administer CPR at that very moment. So for an adult, I am going to administer 30 chest compressions followed by 2 rescue breaths continuously until my casualty will recover or will open the eyes, or the ambulance will come to my rescue, or I will be so tired to a point that I now cannot continue. So yes, I will apply chest compressions, 30 chest compressions followed by 2 rescue breaths until my ambulance arrives.